Tell us a little bit about what some of the newest developments in your field is.
I mean, for pediatric dentistry, there's no kind of groundbreaking inventions that has happened. But I mean, in search for solutions to try to basically either hold off the disease or try to delay the process, I would say one of the things that have come into light in the past couple of years is this product called Silver Diamine Fluoride.
Right.
It's not a new product. It's been around and been used in Asia for many, many years. I would say 10, 20, 30 years.
Yeah.
However, I would say it becomes more popular in North America maybe in the past 3 to 5 years. So what this silver diamine fluoride is basically this antimicrobial liquid that you could apply to cavities and basically in hopes of arresting the decay, slowing them down so they won't keep growing. So how that comes in handy in our world is the fact that, like I talked about before, we're seeing children has cavities when they're really young. Some of them maybe as young as 18 months old, and you'll be surprised to go, what do you mean 18-month-old? How can they get cavities? And a lot of times these babies or infants, they're getting cavities from what we call baby bottle caries, or some terms you may have heard, it could be nursing caries, where they are usually more colicky babies or babies that are not sleeping through the night, that they always need to feed. And they have this habit called on-demand feeding, meaning whenever they wake up, they want to feed. And we see that over time, what has happened is that has caused these baby teeth to rot away. And as you can imagine, how do you fix teeth on a child who is 18 months old? They can't really, some of the kids may not even talk. They may just know a few words. How do you fix them? And really the only way to treat this disease is maybe consider putting them under and get them fixed. But I'm a parent. If you were to ask me to try to consider that on my 18-month-old daughter or son, I may be a bit reluctant. So the silver diamine fluoride come in handy in the sense that maybe we could apply this onto the teeth and stop the decay from growing and basically buy some time until my child is older. So then hoping the risk of putting them to sleep to get them fixed is lower. And I think that makes a lot of sense for a lot of parents where they understand that the disease needs to be treated, but yet is there any way we can wait till my child is at least 2.5, or 3 before we deal with it? So that has been pretty much a lifesaver in our pediatric world, where we offer that quite a lot to parents who are reluctant to seek either sedation options or general anesthetic options, but yet they want to do something. Like you don't want to go home with these cavities knowing they're there and not do anything. So then it's helpful to be able to know that you apply this liquid, okay, there's at least hopes that they won't grow until, and then we fast forward until your child's older and then fix it when they're older.
Right.
Mm-hmm.